just finished the episode for Jennifer. We get a lot into ways to prevent and manage things related to mental health. And those things apply beyond just teenagers. I mean, we talk about a lot of different things in this. We
As
also
usual.
should mention that we talk about suicide, but it is not a deep dive into it, and it is very much just referencing it. But anybody who is watching this episode or listening to this episode and that may be something that they want to be aware of. Know that stress is related to chronic disease. It is very closely linked to hypertension and heart disease and obesity and metabolic syndrome, and those are just to name a few. So how you manage your stress is really important. Something that really stuck out to me during it was she referred to a study that she and an intern had done over the summer with a group of 4-Hers. They asked them about what they would like to know more about related to stress. And a lot of it was kind of like prevention and management type of things. Their top answer was just really surprising to me. Did you find it kind of surprising?
Honestly, I was kind of surprised when she said they were so aware of mental health issues, especially in rural areas, that I'm glad that those are things being talked about.
Yeah.
I don't know that I was surprised as much with that one answer as surprise overall.
So the question that was asked of the 4-Hers was, what is it you want to know more about in terms of stress?
Mm-hmm.
And there are 8 options. So of those 8 options, they are decision-making skills, handling my feelings, deep breathing, healthy habits, and healthy habits includes eating and physical activity and
I think we included sleep
hydration.
hygiene in that.
And sleep hygiene, yes. I included physical activity. They included sleep hygiene and preventing bullying. Number 6 was healthy friendships. 7 was creating routines, and 8 was journaling. Whether you're an adult or a teenager, put in the comments out of those 8 things what you would be interested in learning about more in terms of stress. And maybe don't put your age, but maybe put like if you are under the age of 25 or over the age of 25. If you listen to the podcast, you'll get to hear what the 4-Hers actually said was
I
theirs.
actually like the mention of 4-H because now I am in 4-H. I'm a 4-H educator. And
Yeah.
I think that knowing that transition was coming and listening into how Jennifer worked specifically with youth was really insightful.
This is the Facts of Life, where research-based knowledge from the Family and Consumer Sciences is brought to you with life applications. I'm your host, Amanda Harner.
I'm Hope Smith, a 4-H educator and the graphic guru of the pod.
Our guest today is University of Georgia Rural Health Agent and Licensed Marriage and Family Therapist Jennifer Dunn. And these are the facts on teens and mental health. So, Jennifer, I'm super excited to have you today. Welcome to the show. I like to start off with some small talk. So, how did you end up choosing the career that you're in today?
Yes, so it's a roundabout way, and it'll take me a long time to tell it. So I'll try to be brief, which I'm not always known for being, but I was at UGA changing my major every 5 minutes. I fell into family and consumer sciences and child development, and I worked with kids. I loved working with kids. I worked with a program with juvenile delinquents that were first-time offenders with a couple of professors at UGA, Dr. Bill Quinn and Dr. Jerry Gale, and with a judge. He was the juvenile court judge. And so I did that for 7 years. And while I was doing that, I also went back to school to get my master's in child development and really just enjoyed that work. I did other kid type work, working with youth. I went on to Florida State to pursue a PhD in marriage and family therapy because I really enjoyed. I am a marriage and family therapist and haven't finished my dissertation, so that's a sore subject. But personal growth and all that. Had kids and all the things that you do. Ended up working with adults, and for the last 16 years, I've worked in Southwest Georgia in 24 counties. with adults, kids, substance use, mental health, developmental disabilities, you name it, working with providers to help people find services for their loved one, no matter their age or their diagnosis. And that's been really rewarding. And that led me to the job I'm currently in, which is I came to work for UGA about 9 months ago as the rural health agent. And I'm working with farmers and rural communities. I cover about 41 counties in South Georgia, and trying to help people find services and get better connected where they need it.
Which we'll discuss a little bit more later, because that's a pretty big challenge for a lot of people, whether they're rural or not, honestly. Right. Well, what's your favorite part of what you do?
Oh, that's hard. Well, I kind of feel like I've come full circle, because I worked for UGA back in the 90s, and here I am, and it's whatever year we're in, 2023. And I started back with UGA last year in 2022. So it feels a little like coming back home. I really enjoy working with farmers and their families. My family farms, my dad farms, my husband and I have a timber farm. I joke that we're not farmers because we don't have chickens yet, because I've been bugging my husband to get some chickens, especially when egg prices went up. But yeah, so I really like working with people that I can relate to real easily.
When we decided to do this episode, we had a conversation, talked about how we wanted to do a release in October, and you were like, oh, that's perfect because it's World Mental Health Month. Or World Mental Health Day falls in that month.
Yeah, yes, that's right.
So we are actually releasing this on October 10th, which is on that day, on right. World Mental Health Day. The focus of this episode is really intended to be teen mental health. And part of the reason we chose to focus on teen, adolescents, very like young adults, 25 and under, really has a lot to do with my county. The health department said that they would really like to know some resources. I feel like this would kill two birds with one stone, right?
Yeah.
And there's some things that we're going to talk about during it that are things that are of particular concern to me as I've researched the subject. And a lot of that has to do with substance use in teens and how that affects mental health. So we will be getting into that some. Let's kind of start by laying out some statistics briefly that come from the World Health Organization that have to do with adolescents and mental health. So globally, 1 in 7 10 to 19-year-olds experience a mental health disorder, accounting for 13% of the global burden of disease in this age group. 13% is pretty big. Mm-hmm. Depression, anxiety, and behavioral disorders are among the leading causes of illness and disabilities among adolescents. Suicide is the 4th leading cause of death among 15 to 29-year-olds. The consequence of failing to address adolescent mental health conditions extends into adulthood, impairing both physical and mental health and limiting opportunities to lead fulfilling lives as adults. Which I guess you've probably seen both sides of that, right?
Right.
All right, so let's just dive in.
Okay.
Mental health has been a growing concern for teens and really other age groups too. Can you speak a little bit to why this is?
Well, some of the data you presented, even as scary as it is, when you look at that data for our state, which is in Georgia, and I know people might be listening or watching this from other states, but in Georgia, those numbers are even higher in terms of like the youth suicide rate and things like that. So it makes me even more vigilant in kind of looking at what's going on. There are lots of things that play into this. Just by living in a rural community puts you more at risk. Let's just put that out on the table as part of my job. So working and living in rural communities, and most of the state of Georgia is considered rural. You know, the other things that contribute to this are things like poverty, if they are in a specific ethnic background, come from a different ethnic background. Those are some things that lead to, or what we have found we've seen more prevalence in certain communities: Latino youth, American Indian youth, Black youth, LGBT youth, rural youth, low income youth, youth that are living in immigrant households, and any youth special populations like those that might have interactions with juvenile justice or DFACS, or, which is the Department of Family and Children Services, or anything, like another population might be youth that are experiencing homelessness. So all of those things are contributing to this. Then you add on the past few years where we've had COVID. And so some of the numbers that you just referenced, and some of the ones that are in Georgia specific numbers, have gone up after COVID. And, I think about, so like personally, I have 2 young people in my house. They're technically, I guess, adults now. One just turned 18 and one is 21, but they're both youth to me. They're my children. And so, when I look at what they've gone through, in terms of, missing out on opportunities because school was closed down for a number of, for a couple of years. Like my oldest, he didn't get to have a prom. He didn't get to have like a graduation ceremony the way, that my youngest, who just graduated a couple months back, did. But the youngest, missed out. So he just graduated, but, he took a couple of classes at a local college his senior year. And I was talking to one of the professors, and she was telling me how a lot of these kids are taking, college level classes, and the things that she would have expected them to learn in high school, they didn't because they were, home based. There's this like domino effect where it's made things more challenging for kids. And you add into the fact that more people are talking about mental health. And so stigma is still a thing, but it is getting reduced. So when I go talk to groups of adults and I come in and I want to talk about mental health, everybody's like, get out of here, lady, But if I go talk to a bunch of kids, they love talking about their mental health. They love telling me. They have lots of insight, and they really like talking about it. So I think because they are more articulate about it, they're able to identify easier what is going on with them. We do see the prevalence going up.
So what I hear you saying is it's a combination of different factors. What we know kind of predisposes you to more a higher likelihood of encountering mental health concerns. What are some other ones specific to teens and adolescents that are a big concern? And maybe let's talk about it from the angle of rural health, because yes, most of Georgia is rural, but that's really true across the United States. There's a much larger area that is rural, and it doesn't seem that way a lot of times, but it is.
Yeah, right. So one thing that I think about, I'm just kind of going off the cuff here, but trauma, childhood trauma, and it like kids that have maybe lost a parent or someone or a caregiver that they were close to, and I'm just speaking from personal experience of the youth that I have interacted with. Again, and COVID played a role in that. Anytime we do anything that isolates kids, so COVID was a big factor, where kids were not interacting in social groups anymore, I think plays a major role into this because, I say all the time, isolation is killing us. Another thing that I know is not popular to say, but kids spend a lot of time on their phones, and screen time is an issue. I've got an article that I did pull up when I knew that we were going to be talking, because I immediately thought, what am I going to say? Well, I know I'm going to talk about social media because that's an issue with teens. And there's an article that talks about screen time, and there are some pros and cons to everything. Kids can benefit from being exposed to their computers and their laptops and their phones and having access to information, but it can also, the con is the cyber kind of bullying and the things that go along with that. Those tend to isolate people, not just kids, adults experience this too. And anytime anything is isolating us or kind of keeping us off to ourselves is not really helpful, because, as humans, we're meant to connect with people and interact with people and find like-minded people, or even if we find people that we don't like, we can, we want to, experience that kind of thing. And so I do think some of those are playing a role in what we see with young people today.
I appreciate that you bring that up, because I think it's really a complicated thing. I mean, social media is here to stay.
Yeah.
At least for the foreseeable future. So are all these electronic devices. And we have 3 teens in our family, like they're my stepchildren. I think one thing that has been helpful for one of them in particular is understanding for themselves that these things that can be tools and they can be useful tools, when used too frequently, they can be really harmful. And I don't know, we also have a lot of conversations about how, it's not like bullying is a new thing. It's been around forever, but it is a unique situation comparatively to what I experienced as a kid,
right,
and what you probably experienced as a kid. It's not like you had to worry that if you made some really big mistake, that it's just out there for everybody to see. And it's kind of always almost able to be found, could come back around to haunt you in numerous different ways. And I find it very concerning that there are these mental health things that seem to be more severe popping up, and some of it is connected with the social stuff, how that affects their future too, when they're not fully developed, they're not fully capable of making wise choices. Even the wisest teens are not always capable of making the wisest choices. And so it's scary when they have a tool in their hand that can have very serious ramifications, including employment,
Right. Yeah, I think
took a while to get there. Sorry.
No. I talk to my kids, and sometimes I feel myself like I'm asking myself, should this be something I talk to them about?
Mm.
And if you ever are like me and your gut is saying, should I? The answer is probably yes. Like, yeah, you should. If you're feeling like maybe you should, then yes, you should. So trust your spidey senses on that. Sometimes it's uncomfortable because they're like little adults. My 18-year-old, he's going off to college in a couple of weeks. He does make fairly good decisions, but you're right. I mean, he's not, and boys tend to take a little longer than girls, but I see him doing stuff all the time. And I'm like, what are you thinking? But yet I trust him with a vehicle. I trust him with all these things. And so, one of the things we found as a con of screen use, and it doesn't have to be, just the fact that they're scrolling and playing on, TikTok. It could be video games. It could be any kind of screen time, is that kids that tend to have more screen time tend to have less friends. And that's not necessarily always true, but you see that they have a smaller friend group, kind of IRL in real life. Yeah. And so, they need those in real life experiences to help them with that decision making.
I've noticed in some kids, I mean, I don't know if it'd be interesting to hear if you agree with this, that like so much of their social exposure is taking place over that phone, that they get into real life scenarios and they just don't know how to respond, and they don't know how to engage or relate. And it becomes like a handicap in some ways.
So one of my best friends is a drama teacher, and one of the activities that she in high school locally where I live, and one of the things that she has the kids do is whenever they have a play coming up, she says, why don't you call the local, renting company, the company that rents costumes, and ask them if they have these costumes for this play that we're going to do. And one of the things that she has found is they don't know how to use the phone, like to make a phone call and just say, they get real nervous. And so, I have found, I learned to have my kids. So like when my kids started getting at the age where they were, doing some of their own things, they make their own dentist appointments. They make their own haircut appointments because they need to learn how to call the barbershop, the dentist. I have to still pay for it.
Yeah.
But we as parents do so much for our kids. I think sometimes we limit them because we're not giving them the opportunity to have some of these experiences where they do kind of mess up, where the phone rings and they're like, the person answered, I don't know what I'm supposed to say. But because they're so used to just texting, and snapping.
Yeah, absolutely. That's a really good point too. It kind of reminds me, there was this time with our kids that we had a phone in our house. Like, it wasn't really a landline, it was a VoIP phone, but it basically worked like a landline, right?
Yeah.
And we tried calling it from our cell phones, and because we were going to play a prank on them, we were going to joke with them about something. They didn't answer it.
Right.
We're like,
what is this ringing noise?
We're like, you guys are aware of the phone, I'm pretty sure.
Right.
And it's not like it would ever ring very often. And it was just kind of, we're sitting there hunched behind the sofa with them in the other room. And it's dawning on us like, wow, this is so different than when we were kids. Like, when we were kids, it was everybody in the house fighting for the phone. Like, people were constantly on the phone, especially the more teenagers you had in the house, the more there were fights between adults and teenagers about like who gets the phone when and stuff like that. And it was just a very eye-opening experience. And I think that's kind of where we realized maybe we need to have some conversations about like what you do in an emergency. And
exactly.
It was kind of like bringing up all of that, where did I learn that? And I kind of remember it being in school. And at the same time, I kind of remember it being reinforced by my parents.
Right. Well, and the other thing about like being on a screen is that I think, like when I was growing up, if somebody bullied you, you knew who it was.
Mm-hmm.
Now people can hide behind anonymous screen names, and it's again, it leads to more isolation because you don't know, is that a friend of mine that's pretending to be somebody else? Is that, that those kind of thoughts are real dangerous for young people because it's a lot of uncertainty and not knowing who is on my side. And so my best advice to parents or to educators or caregivers is to have these conversations. I speak to a lot of young people, and one thing I ask them, at least the past few years, is how do you feel about reducing, your time on your phone? And my son played soccer for a long time, and so I'd always go talk to the soccer teams, and some of the kids are like, I need to, I need to go a day without social media or a day without my phone, because for them, it's the same thing. Other kids are like, I couldn't go 5 minutes. Maybe we should talk about that. That's interesting to know. And so just kind of gauging, where they are with limiting, and reducing it if it's a problem for them. I've already talked a lot about being intentional about your use of social media, but also, pay attention if your kid is posting a lot. What are they posting? Is it what kind of content is it? That might give you some insight into what's going on with them, and give them the grace to make mistakes.
Right. So do you see a lot of anxiety, like increased anxiety in kids who spend too much time on their phones?
Yeah. The data shows that in addition to having a lower number of closer friends, they also have lower grades in school. They have higher rates of attention deficit disorder and sleep problems. That's one of the things whenever we're talking to people about kids and mental health issues or whatever, sleep, changes in sleep, whether we're sleeping a lot or not sleeping enough, is kind of one of those things that you want to look at. But some of that in teens is normal. Back to the communication, you really need to be having conversations with, why are you sleeping more, or why are you sleeping less, and what's going on right now in your life, and knowing, who their friends are. That's really important for parents and teachers and caregivers to know, is who is it that they're choosing to spend time with. And I know that, like, with my two, they're boys, but when they hit a certain age, I was like, God, y'all sleep all the time. What does your body need that much sleep? But yeah, their body does need a lot of sleep. So, but it could be a sign of something else. And so I think you kind of have to take it in context. So,
Right.
you don't want to go out and diagnose everybody, all the kids that are sleeping a lot. You want to find out why they're sleeping a lot. Are they just extra tired? I mean, I can tell when my son, who's 6 something, he's going through another growth spurt. And I'm like, aren't you done growing? But I talked to his doctor and he's like, no, he's not. I was like, I cannot afford any more pants. He is 6'1" or 6'2", and I'm like, he's still gonna grow? What?
Right. You're like, what is the least expensive meal we can make?
Seriously.
And just have frozen in the freezer.
Well, and so those are things you want to look for: changes in eating, changes in sleeping. You want to look for kids that maybe are just have a little more irritability. You want to pay attention to if they're all of a sudden they've been making good grades and now, there's like a marked difference in their performance at school. Or maybe they've struggled. So maybe they haven't been like the high achiever in academics, but they're still getting poor grades despite they're trying very hard. So those are things to look at in terms of particularly anxiety and depression. A normal amount of worrying and anxiety is healthy. It's not a bad thing. I tell adults all the time, if you didn't worry about who was going to pay the bills, then who would pay the bills?
Sure.
but when it becomes a little too much, the other thing is like if they complain a lot about an upset stomach or other, physical complaints, and, very frequently, again, that worrying and anxiety, the little bit is okay. But if it gets too much, that it affects their ability to do what they normally do. So if they're worrying to the point that they don't want to go to school tomorrow, they're worrying to the point that, they were always in band, and let's say they don't want to do band anymore, or they were always on debate club and they're now all of a sudden don't want to do that anymore. Like where was the change? What's the difference? But try not to overreact, because sometimes kids change their minds. My son played sports for a long time, and over the years we would see friends of his that had played sports with him the whole time all of a sudden say, they got burned out. That's natural and normal. So, don't just assume, okay, my kid's not playing basketball anymore, something's going on. It could be that they're burned out because they've played for so long and they just want to be a student, but if you see that in conjunction with some other things, that's where you want to start having those conversations and maybe think about, again, asking your kids. And sometimes they don't want to tell their parents, right? They don't want to bother mom and dad because they think they've got too much going on. But maybe saying, I know you might not. So one of the things I've said to Charlie, he's my youngest, I know you might not want to tell me what's going on, but would you tell blank? And I, find another adult that I knew, that he trusted, and see if he would talk to that person. Knowing that if it was something, significant, they would be telling me, right? We don't keep secrets. So I've been that person where other parents is like, my daughter really won't talk to me about what's going on with her, but she says she would talk to you. And I would say right at the beginning, okay, well, I'm not going to keep secrets. So if there's something major, if she tells me something that you need to know, we need to tell her together. We've got to tell mom or dad or grandma. It's hard because like teenagers are experimenting with making new decisions on their own. And so some of it is normal adolescent behavior,
right?
Which is why you have to really kind of know what's going on with them. And they're secretive. They don't want to tell you what's going on with them.
Yeah.
So parenting is hard. Teaching is hard. I always, say nobody's going to get it perfectly. And if you're a parent that's listening to this or a teacher, if you expect perfection, you're going to fail because nobody can be perfect all the time and get it right.
Right. Prevention and management. So I feel like prevention and management is a good thing, even if you have good mental health, because you never know when something may happen that's traumatic in your life. I mean, that's part of why it's trauma, right? And at the same time, like, skills related to prevention and management are things that really help you in a lifelong manner. They're good relationally too. I find one thing you did mention already was sleep, and sleep hygiene is something that I think, especially for teens, this day and age, like with how much access they have to phones, if they have them, they're often in their rooms. They often have screens in their rooms and stuff like that. Like, sleep hygiene is a really big deal. And helping your kid walk through, or if you are a teen, or in your early 20s, like, this is a great time to work on finding what are the things that help me to sleep well. And some of that starts early in the day. It's not just what do I do immediately right before I go to bed?
Right. Yeah.
Can you talk a little about prevention?
So just last week, I did an event with a bunch of 4-H youth because I've been doing so much with adults in this current job that I was like, well, what do young people get stressed out about? So I figured I could talk a little bit about that with you because I thought it was interesting. Yeah. So I asked them, we did a survey. We had 61 kids ages 8 to 16 participate in the survey. And I was looking at the demographics. 60% were male, so 39.3% were females. So we had a few more males than we had girls. Most of them were in the 10 to 14 year age range. So we did have some 15 and 16-year-olds, but there were less of those. And then we did have some 8 and 9-year-olds. There were a few less of those. We had mostly white and Black youth. We did have a couple Hispanic young people, and we had a couple who identified as Native American, and I think 2 that identified as Asian. So it was a good, kind of mix of kids in terms of ages and genders and races. And one of the things so we asked them, like, what is it that you want to know about when it comes to managing your stress? And I termed it in terms of stress. Now, the first time I asked, so we did a little pilot where we asked kids, and one of the things was like healthy relationships, and young kids were like, relationships? I'm in 6th grade. What are you talking about? So we changed it to friendships.
Okay. That's a good point. Cause I think relationships is more broad than sometimes people think when you say that word.
Yeah, it feels very heavy. And so I was like, and these are things that, you don't think about when you're making a little survey, and then the kids are like, wait, what are you talking about? And so some of the things that they were concerned about, the top 3 things that they wanted more information on or more help with was creating routines and time management. And so when I talked to them about what does that mean, they were talking about, like, if they are in an extracurricular activity like band or soccer or tennis or whatever, Boy Scouts or 4-H, and they also had academic stuff, and like they felt like they just don't have good time management skills. So I thought that was and that's just a basic thing that, adults I struggle with, like, oh my gosh, I got all these things on my plate. How do I get them done? So that was a really good, piece of information for me. I was like, yep.
Because we weren't experiencing that before this at all.
The second one was healthy habits. And that was including sleeping and eating and drinking more water. And so one of the things we talked to them a lot about is hydration, particularly because it was really hot this summer. And so, we had a Drink Water Georgia campaign going on. So we talked to them a lot about just staying hydrated. Also talked about, energy drinks and how helpful those are, because a lot of kids, have all this energy already, and then you put, some other energy drink on top of it. And half the time, some of the energy drinks that some of the kids are buying have not been approved by the FDA. And so we really want to make sure they're getting nutritious,
right,
healthy, information about what their bodies are consuming. And then the third one was handling their feelings, which I thought was interesting. Didn't get as much time to talk to them about it, but they felt like sometimes they don't do a good job. The ones I did talk to were a couple of the older kids. I want to say older, 12 to the 16 group, because we were breaking into small groups to do some activities around coping skills. And they just felt like sometimes they don't know how to handle their feelings. It could be that they don't have a good role model. They, one of the boys said, "I just want to go punch something," and for boys and men, sometimes when they're sad, it looks like anger, which we talked about. How do we express our emotions? Does it help to talk about it? Do you have a friend to go to, or sometimes they talked about, well, if I took a test that I studied really hard for and I still did not make a good grade, or I failed, maybe I made a low grade, but I still passed, but it wasn't what I thought I should make. I don't know how to handle that sometimes, which is fair.
right.
That's what they're figuring out as part of being adolescents. And so,
Well, let's be honest, adults have problems with that too. It doesn't totally go away, but yeah, like an adolescent, it would be expected that an adolescent wouldn't be able to handle that as well as an adult, or the hope would be that would be the case.
I will say the number 4 on the list was preventing bullying. So it did not make the top 3, but it was in the top 4. And so I thought that was interesting that they identified that as well.
How many things were on the list?
I can tell you what they were. So we just asked them, what do you want to know more about? Decision-making skills, handling my feelings, deep breathing, healthy habits to include, eating healthy, drinking healthy, sleeping, preventing bullying, healthy friendships, creating routines, and journaling. So, one of the things that I think when you mentioned vaping earlier is a lot of kids get exposed to that at a young age. And when they're trying to figure out how to stay physically active and get quality sleep and spend time outside and all of those things, avoiding things like alcohol, vaping, tobacco are part of creating healthy habits. Often they get exposed to friends who are doing it and they think it's okay. And so, that goes back to knowing who your child is spending time with. That's one thing I think parents can do, and try to recognize and manage when they're struggling with difficult emotions. They're going to struggle with difficult emotions. What do you do when they're struggling? What kind of advice are you giving them?
I like to think about that as, it's not the absence of struggling with emotions, because that is a very human reality. Right. It just is part of being a human being. But it's how you manage that, how you approach that, what you do reactionary, or how you take action when you are struggling.
Yeah. And I think it's hard sometimes because some kids don't want to go to their parents with stuff like that. One of my messages is always mental health is health. So if your kid had a broken arm, would you be like, "Oh, rub some dirt on it"? You would say, "Well, let's go get it set and put in a cast." It's the same thing if they're really struggling. I think, recognizing it's just like having a broken arm, that they may need somebody extra to talk to. What young people can do if they feel like they're going through something like that, I think that if they remember that it's okay to ask for help. It's always okay to ask for help. One thing that I have found in my research, I think it's just good practice, is when kids are willing to help other people, it makes them feel better. So being part of something, whether it's volunteering with like a local community or finding some way to serve, even if it's at your school, or, let's say you don't want to do sports or some sort of extracurricular thing, but maybe you want to help, a specific teacher. Maybe it's the art teacher, or maybe it's the, whoever it might be. Finding a way to give back to whatever your community is super important. And it really gives kids a sense of validation and accomplishment, just like, it's important for adults to feel like they're contributing, like they have a job. It's like kids, I'm not saying every kid needs a job, but finding ways to serve others is really helpful. And investing in healthy relationships. Again, knowing who are the friends that are good to have, because sometimes we invest in relationships that are not healthy. And that's hard when you're a young person trying to figure it out. You're trying to figure out so many things as a teenager. And sometimes, and it's easy for us to see as adults. We're like, we don't want you hanging out with that kid, but they're like, why? They're fun. They probably are very fun.
Right.
It's not to say you can't spend time with that friend, but maybe you can be the positive influence on the friend, so kind of reversing it a little bit. Like I was listening to a webinar the other day, and they talked about young people and how it might've been a TED talk, but they were talking about how young people are really, okay with saying, I need a mental health day, whereas older people are like, suck it up, buttercup, better get to work, better do your thing. You got all this stuff to do, and young people are a little bit more willing to say this, I'm at my wit's end.
Yeah.
And good for them for telling us,
Yeah.
Sometimes our society, kind of celebrates the fact that we're so busy. I got 4 hours of sleep last night. I had to do all this stuff. Well, actually that's not good, Yeah.
The research again, over and over and over again, shows how that's not good. And yet we still highly value it in a really kind of unique way in the United States. I feel like I think other cultures value it too, but it just feels like we have our unique way of doing it here.
Yeah, right. We do.
And I do think that's changing with certain other younger generations, but it'll be interesting to see what happens with that. If you're in work life and you're expressing that, but you have older people in charge of you, that's a very difficult position to be in.
Right. Well, as an older person, because let's be real, I'm 50. I'm part of that group that's like, you don't take a mental health day. But I think because of my job and because of, my background, I understand and appreciate it and realize myself when I have done too much and don't do, take time for myself or my family, and that other things get in the way. So, there's negative consequences to continuing to not take care of myself.
Yeah, I 100% agree with that. I think, I'm in my 40s, so I definitely see where once I got into my 30s and work life and stuff, I think I was able to kind of like let go of what other people thought a little bit more.
Yeah.
And I kind of know how to balance some things better for myself. Not that I've ever done that perfectly.
But the key word there is balance. And I think that's what younger people need to realize and older people need to realize, is that there is a balance to it. So if you have a young person that's like every day is a mental health day, then that's something that you might have to talk about.
We might have a different issue going on here. I don't think it's
but if you have an older person that thinks you should never take time off, you should never have a vacation, you should never, take time to go to the doctor and take care of your physical health, because sometimes what I have found, even personally, is that when I am so stressed out, I start to get physically ill.
Yeah.
Because I have just taken on too much.
Been there.
Learned it the hard way, right?
I don't think people really realize how much we really are a whole person. Everything is connected. Like our mental health is very much connected to other things that are going on. Right. Our environment, it can also be like exacerbated by how we eat, by our lack of physical activity. But, in the same way, like being physically active in the ways that are recommended, eating a healthy, balanced diet, and balance, not running out to fad diets.
Yeah, right.
Not, never having things that you enjoy, but making sure it really is balanced and you're getting plenty of fruits and vegetables, like really is very helpful to your mental health.
Yes.
And hydration too.
I know
I have a hard time with.
Well, I mean, and just this week, my husband, he has a very physically taxing job, and he called me because he's like, I just went cross-eyed and I had to sit down, and I was like, get your butt to the doctor. So he did, and it turned out he had an ocular migraine that he got because he was dehydrated. And I was like, yeah, it's 105 degrees outside. So I, got him a couple of water bottles that attached to his belt loop. He's a coffee drinker, so I'm like, maybe you need to
cut back on that
cut back, just moderation, balance. Again, it's the balance. It's not saying don't have coffee. Of course, you're going to have your morning coffee, but are we drinking coffee all day long? And part of the ocular migraine, one of the things we realized is that's stress related too. So again, your mental health and your physical health are so in sync.
Yeah. Obviously, there's a lot to talk about. What are some things on a community level that people need to be aware of? Like, I know one of the things that you do in your job for us as agents is provide training for how to recognize when there might be someone who is struggling with depression at a level that there's a concern they might be suicidal. Part of the reason I want to share with everyone about this is because we're all part of community, right? And it is an important aspect because, as you've said, especially when you're talking about teens, like teens are going through a developmental phase where they're kind of detaching from the nest. And so that is part of the reason why it is hard for them to talk about things with their parents. So if you're a community member who is in close contact with teens, this becomes a very important talking point because you can really be an advocate for them and step in and sometimes to help save a life in certain situations.
So a year ago, this past week, federally and locally in Georgia, we launched 988, which is the crisis line for anybody in a mental health or suicide crisis. And so a lot of people don't know. We just looked at some research actually earlier this week, maybe it was last week, that I think only 18% of people even know about 988. And already when you look at the 988 calls that are coming in, they're pretty high. And so if we haven't done this mass media campaign and people are calling, what happens when we start to roll it out? And you're going to see this fall, going into this winter, a lot more, media campaigns. But 988 is a great resource for kids or for adults. It's also got a text line. You can text 988. And I'll make sure to send you some kind of graphics and things for you to put in show notes that where people can reach out. When you're calling 988 in Georgia, it's going to take you to a Georgia crisis and access line. And some of the people that called might just need to talk to somebody. They might not need what we call a dispatch, meaning a mobile crisis team to dispatch out. A lot of people, some myths about 988 think that if you call 988, the police are going to show up. The only time the police are going to show up is if somebody has a weapon or there's some danger to the community. Because the whole purpose of 988 is to be different than 911, because we want to make sure police and ambulances and folks like that, fire departments are taking care of the things they need to take care of, and that the mental health folks are taking care of the things that they need to take care of. So that's something that is a resource for everybody. Like you're in Monroe County, right? And so the population in Monroe County was like 28,000 last year, but it's growing. When I looked at the increase in population, I was like, wow, that's a fast growing community. So you can go to dbhdd.georgia.gov, which stands for the Department of Behavioral Health and Developmental Disabilities. And if you go to their homepage, you could just Google Department of Behavioral Health in Georgia. There's a map at the bottom that says find help in your area, and you can click on that, and you can click on your county, and it'll tell you where the providers are in your county. The other thing is that I think almost every county in Georgia, and I'll have to go back and look for Monroe County, but I know you've got listeners from all over the state. We have mental health counselors in the high schools and middle schools. And so that's not something, one of the biggest, I think, hurdles that happens a lot when somebody decides, okay, I'm ready to get help. I need to talk to somebody. Then you got to go through the whole insurance thing. Does insurance going to cover this, or how much are they going to cover? One of the cool things about the Georgia APEX program is they have provided counselors in the school systems to be there regardless of payer source, so that kids can kind of self-identify. Their parents would have to agree that they were talking to somebody at school, so it's not like they're going to go talk to somebody and the parents don't know about it. But teachers can refer students, physical plant workers can refer students, because sometimes it's not always the teachers who know which students might need to go talk to somebody. Sometimes it's the other people who work in the school. Sometimes it might be the person that drives the bus. Just about every school system in Georgia, not every single school, but the school system has somebody that kids can go talk to. And so I think that's really important as a resource. There are lots of private providers that you can, search for in your area. And if anybody, like needed a recommendation, if you reach out to me, I've got colleagues around the state that I go to. So like if I got a call, I'm in South Georgia, but I got a call the other day from a colleague in Augusta, and they said, which is 5 hours from me. I need a referral. And so I was like, well, so I've got 3 people in Augusta. I called, who do you recommend? And they all 3 gave me the same list. So because it's specific, because, if it's a couple that needs assistance, or if it's a young person who is struggling with maybe an eating disorder, or maybe it's because everybody that does therapy has a different kind of specialty or what they're good at. Some people are really good at working with kids, and some are really good at working with families, and some are really good at working with, infidelity issues. And so I'm happy to and part of my license requires that if somebody were to call me, I can kind of point them in the right direction. And then sometimes you might meet a therapist and they're just not your cup of tea. As a person who is a therapist and as a person who's gone to therapy, that's happened to me on both sides. And we never take it personally if somebody comes in and says, we're just not
the right fit.
Yeah. And that I'm like, I'm so glad you said that, because usually I'm thinking the same thing, but I would never, want to say it. So I'm happy when clients identify that, because my goal is for them to be healthy and happy. And if they're not going to get that from me, then maybe Mark is a better fit. So let me refer you to Mark, or whoever the other therapist is. And so one thing I try to remind people is don't give up, because it's just like when you go to a dentist. Sometimes you don't like the dentist office, or you might not like that dental hygienist, or or you need a plumber, and the plumber comes over and you're like, not that plumber. Let me get, same thing happens when you're talking about this kind of service, is that, you might not get it right the first time, but that doesn't mean we don't let our pipes burst. We want, we still have to get our stuff fixed. Right. So we still might need to talk to somebody.
For the few people who are out there who have had really awful experiences in therapy where they're very nervous about going back, what kind of advice would you give to that individual?
To not give up. One of the best things for people who are in recovery, whether it's in recovery from substance use disorder or in recovery from, a mental health disorder, is oftentimes the best resource for them is their peers, somebody else who's kind of been there and done that. And so I usually, recommend that they talk to, we have what's called peer specialists in Georgia. And so we can connect somebody with a peer specialist, because it's one thing for me as a quote professional to be like, I think you should do blank, 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 or go see or talk to this person. It's super different when it's like, hey, I was in your shoes. I went, and had this experience that was good, and I had this experience that was not good. But talking to a peer specialist is important. And so, again, we have a network of peer specialists in our state. That's one thing Georgia has been very, very good at and known for, is developing a peer resource network. And so, if anybody's looking to find who, you can go to the Behavioral Health Services Coalition, the Georgia Parent Support Network. There's lots of like advocacy groups that can connect you to a peer specialist.
I can already think of a group of people that might be very helpful for.
Yeah,
We'll talk about that later. Is there anything else that you have to add or share? Or
just think, at the end of the day, there's always hope, and we want to leave people with that message of hope. If they are struggling, it's easy to say, "Oh, it gets better,"
Mhm.
but it does get better. It can get better, and there are people out there that are good, caring, kind people who want to help other people. It's a matter of kind of finding who they are. Once you find a person that you can connect with, it can change your life. I just tell people to not give up and reach out, and for all the people out there that have listened to this that are like, I'm not struggling, I'm fine. I challenge them to text a friend or call a friend today and just say, I'm thinking about you, to reach out to the person that maybe fell off Facebook a couple of, months back, that you're like, I haven't seen such and such. I wonder how they're doing. If you're thinking about somebody, let them know, because that can mean a lot to that person.
Research-based resources represented and related to this episode of Spectrum Life podcast can be found in the episode notes and description. The views and thoughts expressed in the studio podcast are the speaker's own and do not necessarily represent the views, thoughts, and opinions of the University of Georgia or the guest organizations and board employers. The material and information presented here is for general information purposes only. The University of Georgia name, as well as its guest organizations, and all firms and abbreviations are the property of its owner, and its use does not imply endorsement of or opposition to any specific organization, product, or service.
These are the Facts of Life. Thanks for joining us. Check out our website at facsoflife.extension.uga.edu. That's FACS of life.extension.uga.edu.